My name is Kimberly Chernoby. I'm a chief resident in emergency medicine at Indiana University, and this is my talk, If You See Something, Say Something, Advocacy from the Front Lines. If you see something, say something. This is a phrase that was popularized by the NYPD after 9/11 as a counterterrorism effort. The idea was that if we could empower civilians going about their everyday to say something when they saw something, that we could combat terrorism in our community. I'd say that within medicine, we in emergency medicine are uniquely positioned on the front line in a similar way. It's where the patients with diabetes come for their DKA when they can't afford their insulin, or the asthmatic comes in respiratory distress when they can't afford their albuterol. It's where the failures and injustices of our healthcare system most clearly manifest. So I would say that we as physicians on the front line have a similar obligation, and that if we see something, that we should say something. The story begins intern year. I was working nights on labor and delivery, and I was taking care of a 17-year-old patient who asked for an epidural. When I asked my chief if the patient could have the epidural she wanted, I was told no, because the patient is 17, and the law in Indiana was that minors, even if pregnant, could not consent to their own medical care. And because for whatever reason this patient's parents were not at bedside, even though in a few hours she'd be consenting to the care of her newborn child, she was unable to consent, and as a result could not get the standard of care, could not get the basic health care she needed during this time. The reality is the status quo is easy, right? This has been the law for years. This is how it's always been. And so although it didn't necessarily make sense, that was how it was going to continue to be. And though when pregnant minors came in labor, that they, without their parents could not get what they needed. But what I thought of was this phrase, if you see something, say something. Having gone to school in New York City, it was something that, popped into my head randomly. And so this is just what's out with me. And I said, if I'm seeing something, right, this is not right. And I should say something and I should do something. And so I went to my state medical association. I went to the annual meeting and I asked them to help me pass a law that would allow pregnant minors in our state to obtain the basic care that they needed and to allow them to consent to that care, even if their parents weren't at bedside. A few months later, I found myself in front of our state Senate Health Committee testifying about just that sort of bill. The legislation reflected exactly what I'd put in our resolution, and here I am saying, talking about my experiences. And a few months later, I found myself in Governor Eric Holcomb's office at a bill signing for that bill. And so here we are, and obviously it takes a whole team to accomplish anything like this. And I walked away from that experience actually with the pen that Governor Holcomb used to sign the bill. And it sits on my desk now as a reminder of what we can do if we use our voices. The most special thing, I think, though, was in July when the bill went into effect, a colleague from a different healthcare system forwarded me this email from the system saying, this new bill just went into effect, and this is how we are going to put into action this new law that pregnant minors can consent. And for me, that was the manifestation of a year of work and seeing the impact that the advocacy had really at the bedside and on patients. So a few months later, the medical director of Indianapolis EMS came to me and said, hey, we have this other problem. In Indiana, EMS can transport incapacitated patients when they're incapacitated for mental health reasons, but if it's for a reason other than mental health, like hypoxia, they can't be transported. Otherwise, EMS is liable for kidnapping. I said, well, Mark, if we see something, we have to say something. And clearly that doesn't make sense. We shouldn't abandon or sick and hypoxic or otherwise, dying patients on the roadside or wherever. And so we should fix this. And so again, we engaged our state medical association, went down to the state house and proposed new legislation and testified before all the committees and said, this doesn't make sense. This is what we're seeing. And we are saying that this can be fixed and this is how we can do it. And I'm very glad to say that as of this summer, Hoosiers who are incapacitated for any reason, but who are deemed to need life or limb-saving care can be transported by EMS. And now they can get the care in a timely manner that they need. So I hope from this you feel empowered that if you say something, that you can say something and that you should say something, because really, truly, we can make a difference. Those were just two short examples, but there's a whole list of other things that physicians, even just within Indiana, have accomplished within the last year, such as, getting buyout clauses for physician non-competes or decriminalizing HIV statutes that had been really outdated on our books. Allowing teleoptometry, or even increasing the smoking age in the state of Indiana to the age of 21. It may not seem like it sometimes, but in reality, physicians are respected in our communities, and our legislators really do want to hear from us. And when you go to your state house and you talk about these things, they're so eager to hear from you. They want to listen, they want to learn. And I would just like to end by highlighting 3 of my mentors who are actually all on faculty at IU Emergency Medicine, but who have these other day jobs doing these incredible things like serving as secretary of our Family and Social Service Administration. And so they really are the embodiment of seeing things on the front line and saying something, albeit every day at work. Thank you.